welcome to Askimo TV. We're talking today to Martin Samuel. Martin is a speech and language therapist specializing in adult and degenerative neurological conditions, and he also works with teenage and adult stammering. Hi Martin, how are you?
I'm very well. Morning, Joanne.
Hi Martin. Today we're going to be having a discussion about communication disorders, specifically in adults and geriatrics. So let's begin with, what is a communication disorder?
Okay, so a communication disorder is really any difficulty making or receiving a message through any means, such as speech, writing, facial expressions, listening, reading, etc.
What are some of the causes of communication disorders in adults or geriatrics?
So in adults, which is the area, as you mentioned, that I specialise in, common causes include strokes, head injuries, degenerative conditions, misuse of your voice, and essentially you can have difficulty with several different areas. So with language, you can have difficulty with creating or decoding the message. Aphasia is a common difficulty following stroke or a head injury. Speech, this is the mechanics of getting or delivering the message via speech. So difficulties in these areas can be such as stammering, phonology, which is how sounds are chosen and ordered, the articulation, so the clarity of speech, and also apraxia, which is a motor programming disorder. You can also have problems with writing, such as this is the mechanics of delivering the message via writing, and there's also voice disorders, dementia, and autistic spectrum disorders.
What is involved in a speech and language evaluation?
So an SLT evaluation involves a combination of taking a detailed case history with the patient, and discussion with the patient and their significant others, such as family members or friends, and carrying out a range of formal, which is standardized assessments, and really informal assessments. We also take lots of observations, so with a patient doing different tasks or in different situations or environments. And there's also, the assessment will often last more than one session, and it will need to be regularly reviewed during treatment.
What would happen in a consultation? What would you do, for example, with a patient who had suffered from a stroke?
Okay, so with a stroke patient, firstly, I would see the patient records and also look at their reports to get an image of the patient in my mind. Then there would be an assessment, so a formal assessment and an informal assessment, and usually really a combination of both of these during the session. If possible, you would also want to ask the patient for their view of the difficulty and how it affects them. All of these help to give you a more complete picture of the patient and their difficulties.
Who evaluates and treats communication disorders?
So in the United Kingdom, speech and language therapists treat people with communication disorders. Though we often work with patients, carers, other health professionals and family members, and sometimes we set up programs which are carried out with support workers.
What is the prognosis for somebody suffering from a communication disorder?
The prognosis for resolving communication disorders is very varied, and it really depends on a number of factors, such as the nature of the disorder, the age of the patient, whether the difficulty is acquired or congenital, and really the motivation of the patient. Do they do the exercises as prescribed, and also really the skill of the therapist in dealing with the patient.
Thank you, Martin. Thank you so much for talking to me today.
You're welcome. Thank you.